Good morning, everyone. Thank you for being here, and I want to thank the county executive for taking the time to be with us this morning and provide the briefing on what's happening with the Delta variant, which we are all very concerned about, obviously. We're especially interested to hear how this change in trends that we see in infection rates will impact return to work plans and other potential changes in operating procedures and regulations moving forward. So before we get started with the program, I'd like to thank all of our members who fund our work each and every day, and recognize in particular Rich Products and our Vice Chairman, John Dandies, for his assistance in help in putting together today's program. So the process is going to be, it's going to be a quick meeting. This county executive is going to give us a 15-minute briefing, and he's got all of the data. And then we will take questions and answers from the audience, a couple of housekeeping items. If you wish to ask a question, you've got to make sure that you've identified yourself. So anonymous questions we will not answer, and you've got to type them into the Q&A section. It's likely we won't get to all of the questions in the 15 minutes we have allotted, but we will share all of them with the county executive and follow the meeting. If we're able to answer them ourselves, we will follow our BizLink team will follow up with you after the event. So we're going to get through as many as possible, and I'll be moderating those questions and looking for similar themes. So let's get this started by welcoming and thanking the county executive for making time for the business community this morning. Thank you, sir, and let's get started.
Thanks, Dottie. It's good to be here. I want to thank you for giving me the opportunity to present to the business community. I did a presentation on Tuesday, and a couple of these slides will look familiar to anybody who saw it on Tuesday, but I know, considering I do it at Tuesdays at 2, not everybody has an opportunity to see the presentation, and there's a lot of new information that's happened just since Tuesday. So thank you, and thank you to John Dandies for helping to organize this. Seth, if you can go to the next slide. So just to give you a summary, there are, as of the 28th, there were 90,051 unique COVID-19 cases in Erie County. That goes back from the beginning, of which these are all separate individuals. They're not repeats. Through the 28th, there were 445 total new cases over the last 7 days. And while that is not very large compared to where we were in the winter, it is growing exponentially, and we'll talk about that more. There's 48 total new cases per 100,000 residents in the past 7 days. This is a very important number, and I fully expect this number to continue to go up. And what that means, we'll talk more about that. But yes, weekly cases have increased 6-fold since the week ending July 10th. There were 68 total cases throughout all of Erie County in the week that ended July 10th. In the last 7-day period, it was 445. Still low compared to where we were in the winter, but it is growing, and it's growing exponentially. And then Erie County moved back into the moderate CDC transmission level from low as a risk community, and we'll probably go into the substantial category in the next day, which actually has an impact with the new CDC guidance on masking, and we'll go more into that. But for a number of months or weeks there, we were very low, exceptionally low cases on a weekly basis, and that has grown over the last 3 weeks. Next slide. So this is a map of the United States as of July 26, talking about levels of community transmission. And the reds are bad. That means there's more than 100 new cases over a 7-day period per 100,000 residents. Orange, as you can imagine, that's hot. You shouldn't be in the orange. That's substantial risk. Moderate is where we are as of today and where most of New York State is. And low, of course, means that you have less than 10 cases over 100,000 residents. The Northeast is pretty good. The upper Midwest is pretty good. These are also the areas that have the highest vaccination rates in the United States. You see the Great Plains, there's a lot of blue in some of those sections. It's not because they have great vaccination rates. It's more because they have very few people living in those counties based on the size of some of those counties. So as a county executive, I represent 925,000 people, and I go to the national county conferences. In some of these counties, there's 500 or 600 people in the whole county. So it looks better in the upper Midwest than it probably is. But it's bad in a lot of places. It's bad in Arkansas, Louisiana, Missouri, parts of Texas, Oklahoma, Kansas, Florida. Florida, every county but one is in the high risk of transmission. And even Governor DeSantis recently came out and said, get vaccinated because it'll help save lives. So we're at 48. We do not want to get into 50, but we're probably going to get into 50 as of later today or tomorrow because of the increased numbers that we're seeing. So next slide. So the Delta variant is causing this. And the Delta variant is much more contagious than the previous variants or the original version of COVID-19. There are breakthrough infections, and we'll talk more about that, including in Erie County. But research is showing that a person may have 1,000-fold more viral load in their nasal cavity, their nose, their mouth, when they do testing, even if they're vaccinated, than the original version and variants. Vaccinated individuals can catch it and can get sick. And the data is not 100% conclusive yet, but I think the CDC is going to announce later today that they probably are able to pass it on to others. The goal was to ensure that we basically killed the disease. We crushed COVID, but it's a virus. It can mutate, and it's now mutated into this very, very dangerous version because it is much more contagious and because of the viral load, means that you're going to have more virus in your system, meaning it's tougher to respond if you get sick. Now, good news. Next slide. Well, okay, before I get into good news, CDC new mask guidance for community transmission. So these are the numbers. If we get into the 50 category, and we're at 48 right now, the CDC recommends that everyone should wear a mask in public indoor settings to help prevent spread of Delta variant and protect others. So that is workplaces, that is restaurants, bars, bowling alleys, movie theaters. If you're inside where the public is coming together, and it's not a private residence, but inside where the public's coming together, everyone, regardless of whether or not they are vaccinated, should wear a mask. And that is to prevent the transmission of COVID and the Delta variant, which can affect individuals who are vaccinated and certainly can affect individuals who are unvaccinated. So the CDC recommended that in areas of substantial or high transmission, that everyone wear a mask indoors unless you're in a private setting like a house. So what does this mean for local businesses? It means that the recommendation, as we'll talk about later, is to require people to wear masks. I am going to require everyone who walks into county buildings, as soon as we jump into the substantial category, to wear a mask regardless of whether they're vaccinated. We gave our vaccinated employees an opportunity to show their vaccine card or their Excelsior pass and prove that they're vaccinated so they could get a sticker for their ID, which would then allow them to enter the buildings. And here's the sticker, a little orange sticker, enter the buildings without a mask. Everyone else would have to wear a mask unless they're sitting at their desk. All public had to wear a mask at all times in county buildings. Now everyone's going to. The only exception is we're allowing employees, if they can socially distance at their desks and workplaces, to take the mask off then, but once they come in contact with other members of the public or staff, they have to put their mask back on. We have jumped up tremendously in the last few weeks. We were low. We basically have gone up by 6 times in the last 3 weeks. So next slide. This is hospitalizations. This is a good news portion of it. Hospitalizations have increased. They've almost tripled in just 2 weeks. We expect the hospitalizations to continue to increase because we're having all of these new cases. But the nice thing also is the ICU numbers are staying very, very low. These are extremely low numbers. So what we're seeing, and we'll talk about it more, is even if you catch COVID-19 and you're vaccinated, you can get sick, but it's generally not enough to be hospitalized. There are some people who are vaccinated who are hospitalized, but it's very low number. And the numbers, as we'll talk about with mortality data, it's almost 100%, 96% of individuals who've died since April were unvaccinated. But ICU patients are low. The number of individuals who are hospitalized with COVID under 64, about 42%. It's kind of run that number since the beginning. It's generally been 40% or so since the beginning of COVID. So it just goes to show that young people can get sick and die, especially if they're not vaccinated. Next slide. And here are the death totals as of July 22nd. It's the last day that our Department of Health epidemiological staff has released the data. 96% of the 190 individuals who died from COVID-19 since April 1st in Erie County, 182 of them, or 96%, were not vaccinated. Of the 18 people who died in June, 17 were not vaccinated. Of the 7 people who died in July, 6 were not vaccinated. One of them was under the age of 40. There was one between 40 to 49. I believe that was a 44-year-old woman who was immunocompromised and was doing her best to avoid getting sick. And they think she caught the Delta variant and died in less than a week. She's got an 11-year-old daughter. So people are still getting sick, and unfortunately, people are still dying in Erie County. It's not at the rate it was before, and that's because we have a high vaccination rate and it's protecting people, but not everybody can get vaccinated. There's about, we think, 5% of the population is immunocompromised of adults and can't get vaccinated. And they're at high risk now, especially with the Delta variant. Next slide. So here's some important information from the Department of Health epidemiological staff. We have identified fully vaccinated individuals who test positive and have symptoms, breakthrough cases. It's not a small portion. The COVID-19 vaccines do prevent infection, or do not prevent infection, excuse me. They do not prevent infection, but they do prevent serious illness and death. And for the past 3 weeks, this started out about 10%. It's now about 25 to 30% of all new COVID-19 cases is confirmed in Erie County were in fully vaccinated persons. So that is concerning. There was a report that was just issued on the New York Times about the Provincetown, Massachusetts outbreak. They had a big 4th of July festival. Clusters growing to 882 cases. 74% of them were vaccinated. The Delta variant is very contagious. It's very strong. If you are unvaccinated, you are at much higher risk of serious illness and death. And that's what's happening in the Southeast and the rest of the country, where they have very low vaccination rates, is now their hospitals are starting to get full. They're starting to see a good number of deaths. I've heard reports that local hospitals have received calls from their colleagues down south looking for ventilators because they're running out of ventilators. So we're in a better position than them because we have high vaccination rates, and I'll talk about that next. But I want people to understand, just because you're vaccinated does not mean you can't catch it, and you could get sick. We're seeing that. Our contact tracers are seeing it. We also believe that if people are vaccinated and they get sick, they're more likely to actually get tested than people who are unvaccinated or believe this is a hoax. So we think there's individuals out there who are walking around with it sick who don't want to get tested. We don't know how that's altering the percentage, but our contact tracers are calling people who were required to get tested because of work rules who are positive, and our contact tracers are having to deal with hostile individuals who are like, I'm not sick with COVID. COVID doesn't exist. I have the flu. We're like, no, you got COVID.
So Mark, can I just ask a clarifying question before you move on? So of the 3 weeks, the 25 to 30% of all COVID, those are people who have been tested by the county? Is that where that 25?
All tests coming in to the county through the New York State information system called NICIS.
Oh, so these are people who got a COVID test. Of all the people who got a COVID test, 25 to 30% have tested positive for a non-vaccine.
Yes, they could have been.
Okay.
They could have gotten their test off-site from a county location.
Yeah, got it. Okay.
But we get all the data because our contact tracers have to call these individuals and confirm their vaccination status. And if you're vaccinated, we can confirm it also in the New York State system called NICIS. Yeah. So we can go in, look in the system, confirm that, yes, the person was vaccinated in June, the person was vaccinated in April. They usually confirm they are. So we will know that, yeah, the person's vaccinated or not.
Gotcha. Okay, thanks.
Next slide, please, Seth. So if you are not feeling well, please get tested to know your status, even if you've been vaccinated. The county will test you. You can call 858-2929. If you traveled recently, especially to one of those states that's in the hot zone and you're sick, get tested. If you travel to one of those areas and it's been like a week since you went there, you still might want to think about getting tested just to see if you actually have it, but maybe you're not feeling the symptoms. We are seeing a few people who've been tested because of work requirements who do come back positive but are showing no symptoms. Those are usually fully vaccinated individuals. It's rare now that we have anybody who's unvaccinated who's not showing some symptoms because of the strong viral load of the Delta variant. So you can call 716-858-2929. Appointments are required. Our health lab will test you. We have a few sites across the county. But if you are not feeling well, you should tell every one of your employees, if you're not feeling well, sick, don't come in, call this number, get tested to find out if you have COVID-19 or not. Next slide. Good news is the vaccination numbers, and this is why we're not totally in the hot zone yet, because 60.6% of all Erie County residents have received a first dose. It's actually 71.8% of all residents aged 18 plus. So that's good. So about 28% of our adult population have not gotten vaccinated. We think 4 to 5% can't because of immunocompromised issues. So that's leaving us in a 23, 24% who haven't. So we're high. We're not as high as some of our colleagues across New York State. We are the highest in Western New York. If you have a business outside of Western New York, these numbers are outside of Erie County, the percentage numbers are generally much lower. So, and I can tell you, we had 4 people die in a 3-day period in Erie County hospitals earlier in the week. Only one of them was a county resident, 2 were non-county residents, and 1 was not a resident from New York State who was visiting, who got sick and died. So the other counties in Western New York still are lower COVID rates, but their vaccination rates are much lower too. And then on the second dose, this is great news, 56.6% of all residents have a full vet regimen. That's approximately 65% of all eligible residents, 12 plus. So our vaccination rates are pretty good. But as I've said, the Delta variant protects against serious illness and death from, or excuse me, the COVID-19 protects against serious illness and death, the vaccine from the Delta variant, but it doesn't protect infection. And now it's appearing that it may not even protect from transmission in some individuals. It seems to protect in others, but there are some who have such a high viral load, they may be able to spread it with others. Next slide. So our vaccine sites, the 3 county mass vaccination sites are closed. We have mobile teams going out to various sites on different days. Walk-ins are welcome. We do vax visits. You can get vaccinated at home. So if people are not vaccinated yet, you can call 716-858-2929 and they can get vaccinated. We will vaccinate them. We're not doing Johnson & Johnson vaccines anymore because we don't have any and nobody really has any. We have plenty of Moderna. We have plenty of Pfizer. We're generally giving the Moderna for the adults because we're saving the Pfizer, which we have plenty of still, for the children, because only Pfizer can be used for children under the age of 18 through 12 to 17. But we have plenty of both. We don't have any Johnson & Johnson anymore, and really no one does. Next slide. Businesses and organizations, you are authorized to require masks and 6 feet of social distancing for your employees and patrons within their establishments, regardless of their vaccination status. You have the power to do that. You can prevent somebody from coming into your establishment who's not wearing a mask. Businesses are highly recommended by the Erie County Department of Health to require masks in indoor settings, regardless of vaccination status, especially if we jump into the substantial category either later today or tomorrow. And I do expect us to be in that category either later today or tomorrow by just watching the numbers on a daily basis and how many new cases we've been getting on a daily basis and how it's growing. Businesses are are authorized to require masks if they so choose, regardless of whatever the vaccination status and regardless of whether we are in the substantial or high community spread category. And I'm not going to get into the details of the law associated with mandating vaccines, but there's been some pretty strong statements from the federal government that businesses can also mandate vaccines among employees. I think that's the last official slide. Yes. So I'll open it up to questions. You're muted, Donnie.
Sorry about that. I've only been doing this for a year and a half. You'd think I'd figure out to turn the mute button off. Thank you for your presentation. I appreciate it very much. And we do have some questions. I guess one of the sort of clarifying questions, when we've done several webinars around employers mandating vaccines. And as you may know, we did sort of advocate that businesses would have, absolute liability around COVID, not liability around COVID issues. And it's sort of the guidance that we're hearing from attorneys who look at the New York State law is because of the exceptions for medical reasons or religious reasons, it'd be extremely difficult to mandate. So I'm interested in maybe if you could hold forth a little bit more about if you think there's more protection coming from the federal government, because I think there are businesses that probably would if they felt they could. Do you think that there's going to be more guidance or more sort of legislative protection for employers that for this mandating idea?
I believe so. The EEO has issued a full statement saying that the traditional equal employment opportunity protection categories don't apply in this situation here. Because it is still the country is still under a state of emergency. The county is still under a state of emergency. I never rescinded the state of emergency for basically this reason. And it allows us to kind of turn on a dime to do some other things associated with COVID response. I would be, as an attorney myself, I generally would recommend that counsel for whatever business out there be the one that's giving them the advice on a full substantial analysis. However, the information that we have seen is that businesses can require vaccines just like they can require masks. And because of the protections that were issued early on and in some ways have been reaffirmed lately, it's going to protect them from potential civil suit.
Yeah, the exceptions, I guess, are the things that that they're pretty wide doors that people who really don't want to get vaccinated couldn't. We've heard stories from employers, which I won't waste our time with today, but things that they've heard from their employees around exceptions. But so, Mark, when you say you are recommending that when we get into this heavier level of infection rate, that employers should mandate vaccines at the workplace, we have.
I recommend mask wearing in the workplace.
Oh, I'm sorry. That's what I meant to say. Apologize. But the mask wearing, we have many employers that have businesses that don't have members of the general public coming in. Think about manufacturers, law firms, accounting firms, where it's, the public isn't walking into their workplace. Do you feel that your advice carries to those environments too, in terms of full mask wearing? Because we have heard many of those employers, including the partnership, our sort of return to work plan was if you were vaccinated and could show proof of vaccination, you wouldn't have to wear a mask at work. But so in those cases, do you feel similarly that masks should be required? And will that be something that's sort of mandated? Or is it just a suggestion?
We are suggesting it at this point. Yes, it's maybe not the same place as a supermarket, but people are coming from across the community to these workplaces, and they are exposing themselves potentially at many different locations, including the workplace. And early on and throughout COVID, we generally saw a lot of COVID transmission in workplaces where people were, I know the person in the next office next to me, they look healthy.
Yeah, right.
And then next week, both of them are out sick. So we highly recommend it through the Department of Health. As in regards to mandates, we're not at that point yet. If these numbers continue to grow exponentially and we're seeing this tremendous rise of COVID and our hospitalization numbers start to really uptick, then it's something I am going to consider. I'm not going to deny that. I've had multiple conversations with county executives from across New York State, and we're all kind of in the same boat. We're like,
right.
This is not good. And we were hopeful that we would be able to crush COVID by getting so many people vaccinated that we'd have herd immunity. We don't have herd immunity in the community. We don't certainly have herd immunity in the country. It's actually pretty disappointing to see the numbers in other states where 35 to 40% of
It's
adults
crazy.
are vaccinated, where we're at 72%. So I would highly recommend it, and so does the Department of Health. And as I said, Erie County, as soon as it switches into the substantial category, we're mandating it for all county facilities indoors. And it's just the best protection of being able to say that even if you're vaccinated, with the most recent research and data, you can catch it, you can get sick, and it appears you could probably pass it on to someone else too.
So there's a couple themes of questions here. We only have a few minutes, so I want to try to, and I'm not going to ask them exactly, but the first theme is around access to testing. Will there be expanded testing, or do you feel there needs to be expanded testing opportunities, or are we sort of prepared given the Delta variant now?
There's lots of places to get tested. I don't know if we're going to necessarily expand. What's just happened is the testing amount of people have slowed down.
Mm.
We haven't really reduced the amount of testing locations. We're still doing about the same amount per week of locations, but we just haven't had as many people seek it until recently. So, and there's lots of private entities out there. We've seen the pop-up testing places. I think some of them may have closed because they just weren't seeing the amount of people walking in, but there's still a lot of places you can get tested. When you can call the county, 716-858-2929, and we'll schedule an appointment for someone to get tested. And we're at least 3 places per week. And you got to remember, some of the same people who are doing testing are also some of the same people who have been doing vaccine delivery. So
Yeah.
we split it up. We have a certain number of days per week that is set up for vaccine delivery and the other days for testing.
Well, I happened to check yesterday, and CVS, and I'm sure some of the other pharmacies have the opportunity for walk-in testing as well. That's pretty robust. Some of the other questions in here, Mark, are really around events. So there's one person who's planning a major fundraiser in the fall that relies on 400 people attending. We've folks asking about outdoor events that have been scheduled. What do you think, how is the Delta variant going to impact the sort of the experience in the event space? You know, Shay's just had their, had an event last night. What's your prediction on where all this goes if the Delta variant continues to grow?
I don't know. I was looking at what happened in the Provincetown, Massachusetts outbreak. That was an outdoor festival, 882 cases, of which 74% of them were vaccinated. And those are the people that we know about, the ones who tested positive. As I said, we're seeing and we're hearing from other counties across the United States that people are testing because they have to for work requirements. And when they're told they're positive, they're like, no, I'm not. They go get a second test, and the second test comes back positive, and we call them again. And we know there's a portion of the population that just doesn't want to get tested because they don't want to know. They don't believe it. So I can't give you the advice at this time. Will we be reducing the amount of people who can attend outdoor events in the future? Possibly, if it continues to grow. We're going to watch the cases. We're watching hospitalizations. I said the good thing so far is hospitalizations still remain low, even though they've basically tripled in 2 weeks. I was hoping we'd get to 0, have nobody in hospitals in Erie County with COVID-19, and we went to 10, and there was a big drop from where we were a few months ago when we had 300 people in the hospital pretty much every day for a number of months. We just started creeping back up again, and hospitalization is a lagging indicator. It is not something that you see early on. You see it a week to 10 days after usually the person has tested positive or caught the illness. So with the increase in cases, where this time last week we were at 40, 50 cases, now we're at 98 to 100, I expect sometime next week to see more hospitalizations.
So
and that's going to have an impact with regards to whether or not additional measures are taken.
So last question, and we're right at 9, but there's several people asking about the issue of children getting vaccinated and sort of the uncertainty around returning to school in the fall. From a business standpoint, this is issue that's very substantial because this is keeping some folks out of the workforce.
Mhm.
So would you have any insight at all about what's going to happen with the schools and whether or not, how quickly vaccines will be made available for younger children?
I fully expect all schools to be open, but require masks for everyone. And the CDC also issued that statement a couple of days ago, so that everyone in the school, regardless of vaccination status, would have to wear a mask. Teachers, support staff, children. I expect schools to open on time, but I do expect there to be a mask requirement. And it's truthfully the smartest thing because any child under the age of 12 can't get vaccinated. They have not approved vaccines for younger children yet. It's my understanding the FDA just went back and asked Moderna at least and Pfizer to provide additional research with regards to children under the age of 12. So I expect schools to open in full. I do expect them to require masks on buses, on facilities in the playground, and indoors, just to protect everyone, including the children who cannot be vaccinated. And there was a sad story that came out last week from I think the Southeast of a 5-year-old who caught COVID and died. Very, very rare for a child to get sick to the point of hospitalization. It's exceptionally rare to die, but it can happen. It has happened. We have had children in Oshai Children's Hospital who have had COVID. Thankfully, we have not lost a child to my knowledge from COVID, but we have had some. And if they can't get vaccinated and the viral load is 1,000 times higher than it was with previous variants, children are at risk, at least of getting sick. And as we know how kids are, they're not wearing masks. They're vectors of illness and spread it to everyone else.
Well, this is just a critical time, I know, for the entire community. County Executive, I want to thank you for your leadership on this and being proactive with the business community. I have to just shout out to the County Executive. When all this began in the early days of COVID, he reached out to me and we've been working very cooperatively, making sure that we get the information out there, and just that partnership continues during this really challenging time. So thank you, County Executive, for making time for the business community this morning. We genuinely appreciate it very, very much.
You're welcome. I saw there's one question on here. I just want to answer it because I think it's important.
Sure.
Talks about quarantine individuals and whether there will be mandatory quarantines again for vaccinated individuals. If you are sick with COVID, you are quarantined regardless of whether or not you're vaccinated. So I'm not certain if that answers Ms. Thompson's question, but I want people to understand if you test positive, even with a vaccine, you got to go in quarantine for basically a 2-week period. So if someone in your employer, one of your employees is sick with COVID and they start showing up to work saying, well, I was vaccinated, so it doesn't matter. They, under our rules, have to be quarantined no matter what. So
thank you for that. And there are several other questions there that are more of a technical nature, and someone from our Business Link team will get back to those people, and we'll make sure that you get a copy of all the questions as well, Mark, so they can inform your remarks and future events as well. So thank you again. And as this goes on, this is an open opportunity for you to speak to us and keep us informed about what you're working on. So thank you.
Thanks, Dottie. Be safe and well, everyone.
You too, Mark.
And
take care.
if you're indoors, best to wear a mask. I am now again.
Yeah, I know. Here we go. All right. Thank you, sir. Have a good day. Bye-bye.